Today, incidentally, marks the 47th anniversary of Medicare, signed into law by President Lyndon Johnson on July 30th, 1965. At that time, only 50% of seniors had health insurance. 35% of seniors lived in poverty, which was actually better than it was 30 years prior, when about two-thirds of seniors lived in poverty. Social Security lifted about half of those living in poverty out of poverty, and then Medicare helped them because Social Security not enough to necessarily pay for health care costs. Today, 50 million Americans get guaranteed health care benefits through Medicare. 41 million Americans aged 65 and above, 9 million disabled Americans receiving Social Security benefits. By the time of the baby boomers reach the age of 65, it will be close to 80 million people who will be covered through Medicare. Over half of Medicare beneficiaries have annual incomes of less than $23,000 and savings of less than $53,000. 45% have 3 or more chronic conditions. More than a quarter have cognitive mental impairment. So enjoy your Medicare until people like Bill Keller and whatnot end up figuring out a way of cutting it. Now, of course, Medicare is in some financial is looking at some financial problems in about over the next 10 years, which is a function of the rise in healthcare costs, of which Medicare's reflects less of that than the private health insurance industry. So it's not a function of Medicare that healthcare costs are going up. It's quite the opposite.